This Wednesday, the world marked World Movement Disorder Day. Movement disorder is a neurological condition that disrupts an individual's motor control, impacting their daily lives. The disorder condition can result from genetic to environmental factors or both. It often leads to symptoms like involuntary movements, muscle stiffness, and impaired balance that affect a person's functioning. That is why movement disorder education has to be taken seriously, as victims face stigma and misunderstanding from the society.
Right, we're joined now by Nkechi Obianozie, a medical doctor at the University of Abuja Teaching Hospital. As a matter of fact, she's a consultant neurologist. Thank you so much for joining us on Newsnight tonight. I doubt very much if many people are aware of this World Movement Disorder Day, or specifically, movement disorder. Is it a syndrome? You know, is it a combination of, conditions? What exactly is it? I mean, yeah, we read in that intro that it has to do with, movement and what have you. Tell us more about it, and who really should be concerned about being impacted.
Okay, so movement disorders are just like a broad range of diseases that affect your ability to move, as the name says. So either you have an excess of movement, like tremor, or you have a slowness or a reduction in movement, like slowness. So some people tend to misinterpret the slowness that people have as part of an aging process, without realizing that that might be part of a spectrum of something we call Parkinson's disease or Parkinsonism.
Right.
So maybe you see your mother or your father or somebody close to you that's getting older, and you say, oh no, she's just getting older, she's so slow in getting up from seats or turning over in bed, or she's so stiff or rigid. So that's like the common one, the commonest one, that's Parkinsonism. But there's so many other movement disorders. Some of them like essential tremor. It even happens to young people where they shake. You see people that whenever they are writing or something, you see, their handwriting is shaking. So we have other things like dystonia. Some people they keep squeezing their eyes shut when they talk to you. Those are all different types of movement disorders.
Okay, then, what are there new treatments for this disease, or shall I first say, how can we better monitor and manage movement disorders?
Okay, so majority of them, you can manage them if you first of all diagnose early. So that's why we want people to be aware of the fact that you're having an abnormal movement is something that you should see a neurologist for, and that there are treatments available. The treatments may not cure the disease, but because majority of them are what we call degenerative diseases, they're progressive things.
Over time.
Yes, they get worse over time. But we have medications that can help control the symptoms and help you to be able to live your life productively.
Right, and let's talk more about the management of this disease. I mean, just a few days ago, I actually saw on the micro, blogging site, where this gentleman, elderly though, a drop of cannabis oil was put in his mouth, and in a matter of 4 minutes, he felt much better. All the shaking and trembling seemed to, disappear. Not recommending that to anyone, I have to state that. But is there any link when it comes to cannabis, oil or marijuana and all of that? Because that's controversial in itself. But does it factor in at all in treatment?
Well, for the commonest of all the movement disorders in terms of clinical practice, Parkinson's disease, the mainstay is because there's a lack of a particular chemical we call dopamine. So there's a synthetic form of it, so levodopa is available that they can take the tablets for. So in terms of cannabis, we don't really have, there are some people that suggest maybe there may be some benefits for neuropathic tremors or pain, but it's, still, as you mentioned already rightly, a bit controversial. But we do have a wide range of medications for the different conditions have different treatments. Yeah.
When should we start, getting concerned about it? How early should you start checking?
I would say that, first of all, everybody should just be aware that abnormal movements can be treated and they have a name. And once you have a name, sometimes there's some kind of relief you also get being properly diagnosed.
Right.
And then, especially when you have people above 60. So about 1% of people above 60 will end up with Parkinson's disease.
1%?
Yes, so that's 1 out of 100. Yes.
That's consolation enough.
Well, it's not, well, it is more common because the prevalence is rising.
Right.
You know, we're more exposed to chemicals, we're living longer, herbicides, farmers, etc. These are all risk factors. So once people are getting older, all neurodegenerative diseases become more common, including Parkinson's, dementia, that's memory problems, and all sorts of other problems in the nervous system.
Okay then, doctor, let's try to kill two birds with a stone, as we say, you know. Now, let's move to AIDS, HIV/AIDS. How are we doing as a nation in AIDS control?
Well, I would say from when we were back then in school, where everybody was so afraid of HIV and AIDS, HIV and AIDS has just become like another chronic condition like diabetes or hypertension. I would say that the world has made tremendous progress in terms of HIV and AIDS control. What is a bit alarming, though, is I was speaking with another infectious disease colleague, and we're talking about how young people are coming in now with new infections.
Right.
So we're seeing a lot of younger people with new infections. Maybe our generation, it was much more aware of how to prevent HIV, but then as if everybody became a little bit like, you know, comfortable with the fact that there are medications and treatable ways, you know, you could live your life. So we did say, they did mention that, I don't know the statistics, but that young people, there are a lot of new infections coming up in the younger generation.
And
what age
also
brackets?
that PMC, prevention of mother-to-child transmission is not as effective, you know, in Nigeria as elsewhere. As a matter of fact, more mothers are, you know, infecting their babies with HIV in Nigeria, the second in the world. And of course, just like you said, more young people are coming in. What do we need to do? Because the federal government only today said, look, we're making a lot of progress. Out of 1.9 million people, about 1.6 are on drugs. They're taking their antiretrovirals. But there seems to be some kind of disconnect as far as the youth are concerned. What do we need to begin to do urgently?
I think the government is trying in terms of education, which is like, you know, the foremost, the main tool to drive change. Let them know what HIV is, how to prevent it. And those who do think they've been exposed should be diagnosed and put on medication so that they don't transmit it. Because once their viral load is low, they're not transmitting it either to their children or to their partners. So I think that that's also another message that, you know, young people should be aware of how to prevent. And then if they do suspect, go for early diagnosis and treatment.
In 30 seconds, doctor, let's talk about stigmatization. You know, how can we better manage that and ensure that people do not get more depressed because they've contracted HIV/AIDS?
Is stigmatization as bad as it used to be?
Oh, I don't think so.
Okay.
Well, at least amongst us in the healthcare professionals, because we know that it's a very manageable condition. We've had patients 20 years, 25 years, and they're actually coming down with other things, like maybe the person will end up dying of a stroke or something else. Do you understand?
Right.
So I think that in the healthcare professionals, we're not that, we don't have that stigma issue as much as maybe the public still does to an extent, but I think we've made great progress.
Thank you very much indeed. We'd like to say to Dr. Nkechi Obianozie, consultant neurologist from the University of Abuja. Thank you very much indeed for coming to shed light on these health issues on Newsnight.
Thank you for having me.